Today we will be discussing pediatric radiology. This is chapter 26 in your text, page 325. Pediatric radiology plays an important role in both detecting disease and assessing growth and development for the pediatric patient. The indication to expose dental x-rays is based on individual needs of the patient. Obtaining quality radiographs on children can be challenging. Before exposure, the radiographer needs to make a good first impression by talking to the child and gaining their confidence. The radiographer needs to establish rapport with the child by explaining the procedure so the child understands what is expected. You can explain the procedure by using layman's terms, such as a picture for a radiograph, a camera for a tube head, and a Superman cape for a lead apron. The use of show, tell, and do is useful with children. Many children are fearful of the unknown, so it is important to let them handle the film packet and orient them with the radiographic equipment to help them calm their fears. Many pediatric patients may have sensitive tissues. Children have a flat palate and a shallow floor of the mouth, which enhances these tissues to be sensitive. A REN or an XCP instrument is very difficult to use on a pediatric patient. It is important to use bite wing tabs and a snap array for these sensitive tissues. You can also have steep vertical angles that may be necessary for those sensitive tissues. The radiographer may also palpate the tissues with an index finger to massage and desensitize the sensitive mucosa. The easiest and most comfortable exposures are usually the maxillary anterior radiographs. They can be exposed first to gain a child's confidence and get the child accustomed to the image receptor. You can also do easy occlusal radiographs before bite wings to help with the patient's confidence and to get them accustomed. So it is always important to do the most anterior radiographs first, because those are the most easiest and comfortable exposures for a pediatric patient. It is important to be confident. Talk with authority. A patient may have to sit in a parent's lap, but if they do, always make sure you use a lead apron. It is important to never hold the film in the patient's mouth. You have to remember the ALARA protocols, as low as reasonably achievable. Please refer to Table 26.1, Radiographic Techniques for the Child Patient. Routine x-rays can begin at age 3 in the primary dentition, such as occlusals or even posterior bite wings. We will now discuss the primary dentition radiographs ages 3 to 6 years old. Small oral cavity size, tongue resistance, and gagging can be a problem in small children in the ages of 3 to 6. Routine radiographs can begin as early as age 3, such as occlusals, but at age 4 there is usually better cooperation for taking routine radiographs. Ideally, it's important to expose 4 radiographs for the primary dentition, such as 1 anterior occlusal of each arch, a maxillary mandibular, and 1 posterior bite wing on each side. So a total of 4 films may be taken. Again, 1 maxillary and 1 mandibular occlusal, usually a size 2 film for 3 to 5 years old, and a size 4 occlusal for 6 years and up. And 2 size 0 bite wings are ideal for ages 3 to 6 because they are less stiff than a size 1 bite wing. Sometimes bite wings are not necessary if you can view the interproximal areas. In this example that you can see in this film, bite wings are definitely necessary to see the interproximal areas. This is a radiographic survey mount of the primary dentition, ages 3 to 6. There is one maxillary and one mandibular occlusal, and 2 size 0 bite wings. Next, we will discuss the mixed or transitional dentition. At 6 years old, the first permanent teeth have begun to erupt. It is important to assess the growth and development for a child in the mixed dentition through radiographs. In this slide, you will see this patient is approximately 6 years old due to the first molar eruption. At age 6, a periapical survey or a full mouth survey, which is 18 films including anterior and posterior PAs and bite wings, may be exposed, although a Panorex is much easier and is commonly used at this age. It is important to use either a periapical survey or a Panorex to determine missing or unerupted teeth. This image indicates that a Panorex was taken on a child with a mixed dentition to determine the growth and the tooth development. Panoramic radiographs are often prescribed to supplement intraoral exposures. Panoramic radiographs do not image structures with the clarity of intraoral radiographs and do not reveal details like early carious lesions. Therefore, it is important to take a full mouth survey or a Panorex plus bite wings or periapicals. This image shows that this is a maxillary molar periapical of a transitional dentition. At age 6 in the mixed dentition, 2 size number 2 bite wings should be used if the first molars are erupted. In this film, you can see the radiographer used a size 1 film in this slide, and the x-ray does not adequately show the developing premolars. If the child has 6-year molars, please use size 2 bite wings, not size 1 film. During the ages 9 to 12 of the transitional dentition, it is important to take 4 horizontal bite wings and a PA survey or a Panorex for caries risk and growth development of the child. In ages 9 to 12, a second Panorex may be exposed if the patient's last Panorex is no less than 3 to 5 years prior. A periapical survey may be exposed if a panoramic unit is not available, or the full mouth survey may supplement a Panorex. At the ULM clinic, we recommend that you take 2 size number 2 bite wings if the second molars have not yet fully erupted. But in the mixed dentition, you must always get the distal of the canine. Between the ages of 12 to 14, all permanent teeth except the third molars have usually erupted. It's during this adolescent period that gross, rapid, and metabolic changes occur that heighten the possibility of dental caries and the increased need for preventative oral hygiene care. We will now discuss the permanent dentition ages 12 to 14 and the radiography that we should use. In the permanent dentition, adult surveys may be used if needed. The full mouth survey is recommended for the adolescent, and it is the same that is required for the adult patient. Usually it consists of 14 PAs and 4 bite wing radiographs. Between 12 to 14 years, a patient can usually tolerate 4 size number 2 bite wings. In the premolar bite wing, be sure to always get the distal of the canine for the permanent dentition. This is required for the ULM clinic, but it is important as a rule of thumb in any situation for radiographs. In the permanent dentition, a Panorex may be substituted for a full mouth survey in an adolescent mouth. Primary teeth are important too. Children have the same basic needs for oral health care as do adults. In fact, the best time to prevent dental problems is in childhood. During the formative years, the danger of permanent damage from dental neglect is the greatest. Children are at higher risk for caries that progress more rapidly than in adults. Infected teeth, disturbances in normal development, lesions, etc. can sometimes only be discovered through radiographs. Radiographs play an important role